Measles cases are on the rise around the country and here in Arizona. Joining us to discuss the uptick and what's behind it is Will Humble. He's the executive director of Arizona's Public Health Association. Hi, Will. Thanks for coming in.
Good evening. Thanks.
Okay, let's start with math with you, too. Where are we in terms of cases?
Yeah, so a few weeks ago, we had our first initial case of measles, and it started like it always does with a travel case. And it's either these measles outbreaks usually start with somebody who traveled to either to Europe or Southern Asia, who were the U.S. citizen who was unvaccinated, went to a place in the world that has a lot of measles, comes back and then gets measles here, or a foreign traveler on a visa and stuff, usually from Southern Asia, sometimes Europe. Austria has a whole bunch of cases right now, comes in, and then we have that initial case. So right now, I think there's 3 cases in Arizona. So that initial case caused 2 more cases. And now we're in the incubation period for the exposures that occurred with those 2 new cases. So we'll find out probably in the next 7 to 14 days how many more cases come from that second tier cases, the set of cases.
So, Will, somebody might hear 3 cases and say, well, 3 is nothing. I mean, we have millions of people in Arizona.
Yeah, well, it's super contagious. We talked about this before the show. It's the most contagious virus there is. I mean, super contagious. So all it takes is some unvaccinated people to walk through a room that a person who was spreading the virus was in 2 hours ago, and they will almost certainly come down with measles. So it's not like COVID, which, we were a totally unvaccinated state at the beginning of that. So we have lots of vaccine on board. It's not like it was in 1960, for example, when they're before the vaccine. But it can cascade into cases. And the big deal is if it were to get into schools. Right now, so far, none of these cases have been in a school, but if this virus, if one of these persons was in contact with kids in school from, say, Yavapai or Mojave counties, our least vaccinated counties, it could quickly explode into a whole bunch of cases because vaccination rates among kids are very low in some of those counties.
The state health department actually says that the last school year, Arizona's exemption rate for kindergartners was 7%, and that's significantly higher than the national rate. Does that concern you, or do you, because you mentioned a couple of counties, is it mostly in certain areas? If you look at the statewide number, that's less important to me than some of these parts of the state with really low vaccination rates. And by the way, even in Maricopa County, which has I think the exemption rate is like 11%, something like that. It's close to that. Like charter schools, for example, within Maricopa County have much lower vaccination rates than that on the exemption side. So there's these pockets of places that are really fertile ground for really spreading the virus quickly. Now, we might get lucky, and these initial cases might go to places where people are generally pretty well vaccinated, and if that continues to happen, then it'll be this 1-off, 2-off, 4-case kind of thing until we can come to the end of this. But if it gets into a school district, like I talked about, somewhere like Yavapai, it's Katie by the door, really. I mean, there's so many susceptible kids in some of those schools. And what happens when someone gets the measles? Describe the sickness.
Yeah, so the symptoms are like really high fever, sometimes really, really high, like 105. 20% of the kids will get pneumonia. It's fatal sometimes. That's fairly rare. It can cause encephalitis. So it's a really scary illness. And if you go back to like my parents' generation, like they were like, in fact, I had measles in '62. It was a really scary disease, and I think many parents don't have the lived experience of knowing how scary measles can be, and that is, I think, playing into some of this vaccine hesitancy that we see in some of these parts of the state.
We had a significant outbreak in 2016 in Arizona. That was the last one. I think it was limited to, it was a law enforcement.
Yeah, it was a case that came back from Disneyland. So somebody got exposed, came back to, it was at Kearney. I was still at the state health department back then. Well, just after I left. And so it was sort of in Pinal and Gila County area. I think that had 3 generations of cases before it ended. So fortunately, those initial cases didn't get into a super like an area with really low vaccination rates, and so it didn't cascade like it potentially could. Not saying it is going to cascade these initial cases, but it all depends on where these cases were and who was exposed in terms of how many more generations and how big this could get, or could end right here. We don't know.
Well, I guess we'll have to stay tuned, as they say, right, Will?
Yep.
Okay, thank you so much. Always a wealth of information. Appreciate you coming in.
My pleasure.